Hello, Dr. Pacheco. Thank you for joining us today in our Cafecito con NHCOA. It's a pleasure to have you. So can you please introduce yourself?
Thank you so much. Good afternoon. My name is Henry Pacheco. I am a physician. I've been a physician for a little over 15 years. After that, I decided to do more public health, mostly concentrated on issues related to health and well-being of Latino and Hispanic populations.
So let's start with the questions. The first one is, can you mix COVID-19 vaccines doses in case of a shortage?
Because there's a lack of studies, it's not recommended to mix unless there's a mistake or, God forbid, unless there's a serious shortage.
What happens if you don't get the second dose as scheduled?
If you stop at the first dosage, then you're really cheating yourself from getting the full protection that the two doses give you. You want to get both dosages with Pfizer and Moderna, and definitely to be fully protected to the extent that this vaccine can protect.
So what are the side effects of COVID-19 vaccines?
The side effects of the COVID-19 vaccine are pretty similar to the side effects of many vaccines that we are used to, and particularly children are used to, in the sense that, you'll get pain in the shoulder where you're vaccinated, local pain, local tenderness. But some people experience a headache later on and maybe a little fever and malaise, a little uncertain fatigue. That's, the most common. Some people experience nothing at all. But those side effects of the vaccine, it's a good sign. It means your immune system, your body is reacting and it's fighting and the defenses are waking up, let's say.
After someone is infected with the virus, what will be the time he or she should wait to get vaccinated?
It is recommended you wait at least 90 days to get vaccinated. The reason is because you don't want to get vaccinated too early, or because you don't know, for example, if what you're feeling is related to the vaccine. So 90 days is what's been established as the waiting time.
After you get the COVID-19 vaccine, can you still get infected?
After COVID vaccine, you can still get infected, so far as knowledge is, to the extent of our knowledge. Meaning, you were in a crowded place, you weren't using your mask, and the virus comes and is in your throat, in your oropharynx. So yes, you can still get infected. However, because you've been vaccinated, the virus won't move from there. It won't infect the rest of your body, and you won't get the whole disease.
Why some vaccines required 2 doses and others 1 dose?
All of these vaccines are developed by separate laboratories under different conditions. When Pfizer and Moderna were each in their own laboratories developing their own vaccine, they found that after a first dose, after a certain period of time, the effectiveness of the vaccine was not that great. So they decided that, they should try another dose. So they tried a second dose, and then they found, protection is pretty good. So that's how they determined that they need 2 doses. But this once again, independently working from each other. Now, the most recent Johnson & Johnson, the most recent vaccine in the United States, right? Johnson & Johnson comes out with a vaccine that says, you only need 1 dose to get the same level of effectiveness of Pfizer and Moderna. Because once again, in their studies, after the first dose of their vaccine, they found that the effectiveness was good enough that you did not need a second dose, at least initially.
What is the effectiveness of the vaccine against new variants of the virus?
As we speak, they're probably popping up in the news, other variants. But the most common variants that we heard about were the UK strain, the Brazilian strain, the South African strain. So far, the vaccines that are being used in this country, which is Moderna and Pfizer, are effective against these strains. They are effective. However, it's all the more important for all of us to get vaccinated as soon as possible. Therefore, we don't create in our bodies breeding grounds for the virus to multiply and create new strains.
So if a person had COVID-19, how much time he or she should wait to donate plasma?
Convalescent plasma contains the antibodies that your body developed to fight the virus. So therefore, when you donate convalescent plasma, then you're also donating these antibodies that are already made to fight the virus. So that has been probably one of the most effective treatments against COVID. How long you should wait? I believe it's 14 to 27 days that you can wait before you donate.
Thank you for watching the first part of our interview with Dr. Pacheco about COVID-19 vaccines, addressing questions and concerns. Follow our social media platforms to watch the second part of the video. See you soon!